Hi, I'm Lindsay.
And I'm Kenzie.
And we're going to demonstrate an oral mic exam for somebody with hyperkinetic dysarthria, more specifically dystonia. And patients with dystonia have involuntary movements that lead to facial grimacing, mouth opening and closing, lip pursing or retraction, profusion, movements of the tongue. But you're not going to see very many of these involuntary movements with our patient today. We just wanted to make that a note because that's a very common thing. But rest of the oral mic will be most commonly normal, so we're going to get started. I'm going to be playing the SLP.
And I'm the patient.
Okay, so the first thing I'm going to do is look at her face, and everything looks symmetrical, which is normal for hyperkinetic dysarthria. And I'm going to touch the side of your cheek, and you tell me if you feel it, okay? Okay, so she feels that, and that's normal. So now I'm going to look at her lips, and everything looks symmetrical and normal with her lips. Now I'm going to put this up to it, and I want you to protrude your lips. So let me see the strength. Okay, so her strength was very good, which is normal for hyperkinetic dysarthria. So now I want you to pucker them out like you're giving a kiss. Good. Now can you retract them like you're smiling at me? Good. Now we're going to go back and forth between pucker and retraction. Ready? Good. So everything there was normal. Now I'm going to look at your tongue. Can you stick your tongue out for me? Good. Everything looks symmetrical there. So can you try to touch your chin? Good. What about your nose? Good. Now can you go from side to side? Okay, good. Now I'm going to put this out, and I want you to stick your tongue out and give me some force. Good. So her strength of her tongue is very good. Now we're going to do the side to side movement again, and I'm going to put some force on it. Good. Good. So everything there was normal. And like I said, you'd see these involuntary movements during this part of the oral mic and throughout the jaw, the lips, and the tongue, but we're not going to do that right now. So I'm going to look at your jaw, and everything looks symmetrical, which is normal for hyperkinetic dysarthria. So I'm going to have you open it, and I'm going to put some force, and I'm going to see your strength. Good. She's got good strength with her jaw. So now I'm going to check your hard and soft palate. I'm going to have you open up. Good. Now I'm going to see the movement of that when you say ah for me. Good. So everything there was symmetrical, and the strength looks like it's normal. So I'm going to check her gag reflex now. Good. So that is normal, like in the hyperkinetic dysarthria, most gag reflexes are normal. Now, do you ever experience any drooling?
Yeah.
So what time, like during sleeping or when you're up?
When I'm awake.
When you're awake? Okay. What about when you're eating? How does that go for you?
A lot of times I get food stuck in my cheek or in the back of my throat.
Okay, so this is very common with hyperkinetic dysarthria. They usually experience drooling, and they might have these eating difficulties. They might complain of it getting stuck in their throat, or they're unable to get it out of the oral phase. So now I'm going to have you say some sounds for me, okay? So can you say puff, puff, puff for me?
Puff, puff, puff.
Good. So you notice that she did some of those involuntary movements you were talking about, and that's very common. It's also, her rhythm wasn't very fast. Now can we do pataka, pataka?
Pataka, pataka.
Good. So with those involuntary movements, that usually leads to their imprecise consonants and their difficulty saying these different consonants. So that is it for today.